So the ketogenic diet is a disease-causing diet, and it is really heartbreaking. I call the ketogenic diet Atkins 2.0 because when I was a kid, Dr. Atkins was famous for his meat-based diet that was helping people lose weight. But Dr. Atkins, they found post-mortem, most likely died of a heart attack. He had heart disease.
Does a keto diet make diabetes worse? Hi, I'm Dr. Eric Westman, and this is news to me. I am using a keto diet in my office, research and clinical practice to reverse diabetes. Let's see what I'm missing out on. Here's a video called Why the Keto Diet Makes Diabetes Worse. I guess it's already a fact. Well, it's not, but let's see what this doctor says. Dr. Brooke Goldner, you want to always consider the source of the video, has a Goodbye Lupus website, and on the bottom there, her other founding organizations are veganmedicaldoctor.com, and she's, a author and board certified medical doctor. I don't know what type. She went to Temple University School of Medicine, chief resident at UCLA, and holds a plant-based nutrition from Cornell University a certificate. Well, I think we may see a little plant-based bias here, but maybe not. But Dr. Goldner apparently says the keto diet makes diabetes worse. Now, I've been studying and using keto diets for over 20 years. I suppose it would depend what kind of keto diet you're talking about. I use one that's based on real food and not adding in all sorts of products from the internet, keto drinks and apple cider vinegar, medium chain triglyceride. I don't advocate any of those things, just real food. And in my experience, diabetes gets better or reverses entirely. So let's see the rationale for Dr. Brooke Goldner.
So the ketogenic diet is a disease-causing diet, and it is really heartbreaking. I call the ketogenic diet Atkins 2.0 because when I was a kid, Dr. Atkins was famous for his meat-based diet that was helping people lose weight. But Dr. Atkins, they found post-mortem, most likely died of a heart attack. He had heart disease.
Oh, hold on. Dr. Goldner, I knew Dr. Atkins. I actually met Dr. Atkins in 1998 and asked him for money to do research on the diet that he was promoting. And actually, I knew Dr. Atkins, sadly, when he slipped on the ice in New York City and died of a bleed into his brain. So this is not getting off into a good start here, using hearsay, and there's a whole other story about how that death certificate got taken out by the plant-based folks and misrepresented. And actually, Dr. Atkins sadly slipped on the ice in New York City and died of a brain injury, not a heart attack. But okay, that was a swing and a miss.
Hello, my name is Dr. Brooke Goldner from Goodbye Lupus and Goodbye Autoimmune Disease. But what I want to talk to you about today is why the ketogenic diet or keto diet may make your labs look better, but actually be making you sicker. And I want to talk about this today because it's been coming up a lot. People are looking for other ways to get better besides the usual medications and procedures. And I am all for that. I'm lupus free 17 years thanks to changing my diet. But because of that, it has become a fad to try different kinds of diets. And while some can be very effective in improving health, others are actually making people sicker. And keto or ketogenic diets are one of those diets. And I want to explain how. So one of the ways that it's become very popular is for weight loss and diabetes. Now, I want to talk about type 2 diabetes and what causes it and why the ketogenic diet can make your labs look better while still making you sicker. So let's look at type 2 diabetes. Type 2 diabetes, how most people understand it, is that when you eat anything that has carbohydrates like fruits or even vegetables, pastas, anything like that, grains, that instead of your blood sugar going up a normal amount, your blood sugar goes up too much. And when your blood sugar remains too high, those sugars can coat things like your nerves, and they can cause problems with your vision, erectile dysfunction, and even cause people to have neuropathies that end up with removal or loss of their limbs. So it's a dangerous disease that can cause a lot of disability. People with diabetes also usually end up dying of heart attacks. So they have a lot of risk in many different areas of their body. Now, the understanding for type 2 diabetes is that the cause of it is something called insulin resistance. Insulin resistance means that the normal response to cells when you eat any kind of sugar will be for your body to release something called insulin. Insulin then travels along your bloodstream and attaches to mostly muscle cells and tells them to bring sugar in from the bloodstream. When that happens, the bloodstream shows the sugar levels have gone down. That is normal and healthy. When someone has something called insulin resistance, which is believed to be the cause of type 2 diabetes, it means that when insulin comes along, it does not elicit that response. And so therefore the sugar stays in the bloodstream and blood sugar stays high and then gets higher and higher as people eat. The way we have treated this medically is to give people medications to try to overcome this insulin resistance. And for some people, they even need to take extra insulin to try to get that healthy response. Now, when I was in training over 20 years ago, the thought was, if sugar's the problem, we should just tell people with diabetes to eat less sugar. And if you do that, you will see that blood sugar levels are lower, but those same people will continue to need their medications throughout their life and still struggle with this disease. Now, the ketogenic diet will fit that paradigm, right? So if you eat foods that are just heavy in meats and fats and eat very little carbohydrates, which is what the ketogenic diet tells people to do, then your blood sugars will stay low. Not because you're no longer insulin resistant, but because you're not eating foods that provoke insulin or require insulin to bring your blood sugar level down.
Oh, wait a second. I totally agreed until we got to this part where suddenly you're not better. So hang on. So if you look at the diagnosis of diabetes, and if you've been diagnosed with prediabetes or diabetes, and you look at the American Diabetes Association definition of diabetes, it's an elevated blood sugar. So it makes sense to me, and it actually made sense to doctors 100 years ago, Dr. Goldner, in the textbook of medicine by William Osler. I have the copy in my office. In 1923, the low-carb diet is what was recommended for type 2 diabetes. And because if the blood sugar is the problem, that's the definition of diabetes is elevated blood sugar. Think about it. If you've been diagnosed or checked for it, they check the blood sugar. They don't check anything. You actually can't check for insulin resistance directly. We infer it. So actually checking the blood sugar and finding the blood sugar to be normal and then not having any complications down the road by not eating carbohydrates, by eating a keto diet, is curing the diabetes. Actually now I see what's going on. This is the kind of fear-mongering for those who want to, everything looks better, but one day it's going to get you. Hang on, because actually insulin resistance is fixed when your glucose is normal and your diet doesn't contain carbohydrate. So just let's listen to this logic a little closer.
Here's the problem. Our new understanding, thankfully helped a lot by Dr. Neil Barnard, is that insulin resistance is actually caused by saturated fats gumming up insulin receptors. So that means if you have a ton of fat coming along and it binds to that insulin receptor, you have insulin coming along and it wants to bind that insulin receptor to notify your muscles to pull sugar in. But the insulin receptor now has gum in it. Like if you can imagine gum in a lock where a key can't get in anymore. So the insulin can't bind. And if that happens, then sugars are not brought into the cell and sugars stay high. So what we've actually found is that eating a lot of fats, specifically saturated fats, animal fats, gums up those receptors, causes the insulin resistance. So if you stop eating...
So hang on. Actually, I've never heard it described that way. I've heard it described, this alternative theory of insulin resistance and diabetes where saturated fat is the cause. Well, it's actually fat in the cell that is the cause, not in the receptor gumming it up. So I totally agree. Intracellular saturated fat, or fat, is a cause, and actually losing weight and doing a keto diet fixes the intracellular fat. This is a common plant-based sort of theory that the only way to fix fat in the body is to cut fat out of the food. Well, no, that's not true. Fatty liver is caused by carbs in the food, or one way to fix fatty liver is to cut carbs out of the food. So actually, that picture was kind of weird. I hadn't seen it called it that way. But think about it. If the blood sugar is normal and you're not eating carbs, this saturated fat gumming up the insulin, it doesn't matter because your blood sugar is normal. So even if that was going on, your blood sugar is normal. You don't have diabetes. But so let's think about this lot. And I think it's important to work through this illogic so that you understand why some doctors are so fixated on something, because they're taught this kind of, oh, it's not just blood sugar, it's something else, and oh, you're not really better when everything you're measuring and you feel better. Let's just keep going.
Animal products. Then those insulin receptors will open up again and insulin resistance goes away. So when you don't eat any kind of carbohydrates, you can hide the fact that you still have diabetes.
No, I totally disagree. You're not diabetic anymore. We don't say diabetic anymore. We say someone affected by diabetes, because you don't have to have diabetes forever. In fact, that kind of language I learned in the obesity medicine world. We don't call someone obese, or we definitely don't call someone fat. We call someone heavy, or some other word, and we say someone is affected by obesity because you can actually reverse it and change it. So this person affected by type 2 diabetes with a normal blood sugar on a keto diet, it is fixed. It's cured. It's not. There's problem isn't still going on. I totally disagree.
Now, I've had these arguments with keto doctors who are very excited that when they put their patients on a ketogenic diet, their blood sugars stay low, their body fat goes down, their body weight goes down, and they seem to be doing fairly well.
And they are. I just don't get this logic.
It's very dangerous.
No, it's not dangerous.
I was having an argument with another doctor about this on a Fox show, and he suggested that his way was better because people were losing so much weight and their HbA1c was staying low, and he believed that meant they were no longer diabetic.
Yes, well, did you hear where they were debating? It was on a TV show. You need to have these debates, Dr. Goldner, in medical meetings where there are scientists and researchers from academic organizations. Actually, a big study with many publications recently called the Verta Health study, showing that you can reverse type 2 diabetes using a low-carb diet, and so they don't have this problem going on just waiting to come get you. No, if the blood sugar is normal, you're off your medicines, you're feeling well, the weight's down, you don't have diabetes anymore. And if you have no complications from the diabetes, you're not going to get them because the blood sugar is normal now.
And I said, there's a lot of ways to lower blood sugar and lose weight without giving people cancer and heart disease, because that is the other part that's not being addressed here, is that even if you can keep blood sugar low, if that was the only problem, then the keto diet would be working, right? You can keep the blood sugar levels low by not consuming anything that provokes higher blood sugar. The problem is you now are increasing your risk of heart disease and cancer. There was a study done at Harvard where they found that eating meat increases your risk of all causes of mortality, regardless of other.
Oh, so now here we go, toggling into the apples and oranges sort of thing. I'm not a big fan of nutritional epidemiology, which is ask people what they're eating, follow them over time, and then eat the way healthy people eat. No, just because someone's healthy and they're eating a certain way doesn't mean if you change to that way of eating, you're going to be healthy. It's the fatal flaw of nutritional epidemiology. But so in that context of carb eating and all other lifestyle factors, the meat and health relationship is so minor that most epidemiologists and evidence-based medicine doctors would dismiss it as being irrelevant. But actually, to the point of the cardiometabolic risk, there are several papers now that show if you calculate cardiometabolic risk, the risk actually goes down on a low-carb diet, not because of the meat and all, it's because of the biologic changes. The triglyceride going down, the HDL going up, the abdominal circumference going down, the blood sugar getting better, the blood pressure getting better. So this is called the metabolic syndrome. So a low-carb keto diet reduces cardiometabolic risk by addressing the metabolic syndrome. So this is using the nutritional epidemiology studies. I've talked about this before. Please see my other videos about the association of meat. Meat is fine, and the evidence-based medicine world within academia, within the universities, medical universities, disagree with the idea that meat and saturated fat is bad for you. So it's an academic dissension, if you will, within the medical world.
Risk factors. T. Colin Campbell did research that showed that milk protein specifically turns on your cancer genes at the promoter region of your actual DNA.
T. Colin Campbell. I debated him once. There's an old YouTube on that. He did something called we're probably going to hear the China study, which is a epidemiology study and is not definitive research. Epidemiology is hypothesis generating, but it's almost like this world, the plant-based bias folks have created these sort of larger than life people, the T. Colin Campbell, the Neil Barnard, in fact there are movies about this, the documentaries, Forks Over Knives, things like that, where it really doesn't show you the data and outcomes in studies because they don't exist. It's really more just what people are saying. And remember, I'm not against other types of diets. I just don't want people to call out keto being bad when there's no evidence for it. I think there are a lot of ways to be healthy, and probably the way Dr. Goldner has eaten to fix her own health issues is probably a healthy way to eat. I don't know. Ask a keto expert about a keto diet. Don't ask a non-keto expert about a keto diet. Right?
Of your actual DNA. So we know that animal fats are not just dangerous because of heart disease, but because of cancer, and increases your risk of dying from anything.
Yeah, so that's so compelling, isn't it? So no, the researchers have all come together, the nutrition researchers, and have papers even in the cardiology journals saying saturated fat is not a problem. But it hasn't percolated out into the medical organization and recommendation world very, very strongly, and it probably never will in the circles of folks who don't want you to eat saturated fat because there's a false assumption that meat is the only thing that has saturated fat, and they don't want you to eat meat for ethical, other sorts of reasons, which I think are valid reasons, but it's not because of health. But they put it in the garb under the mantle of health when it's really not.
So a diet that is primarily full of animal fats and animal proteins is actually making you sicker, even if you're getting thinner and even if you have a better HbA1c. Now
I respectfully disagree. If your A1C is normal, you're off your diabetes medicine, so you're following a diet, or you're one of my patients. This isn't compelling me to tell you to stop what you're doing. If you haven't tried a low-carb keto diet, this doctor is off base, and it's kind of typical of doctors who don't really understand the keto diet. They don't use it, but they're experts in telling you not to do it. And that could just be a general phenomenon. If you don't know about it, it must be bad. I mean, I could be doing videos on how bad veganism is because it doesn't have vitamin B12 in the diet itself. You have to add it in, but I don't. I think you can be healthy doing that. What I am trying to do is just say, this person is not an expert in what she's talking about.
Now, let me explain what HbA1c is. HbA1c is a test that's normally done for diabetes. And what it shows is what your average blood sugar is over the course of 3 months. So people with diabetes have a very high HbA1c, and that shows that they are insulin resistant, that their blood sugars are staying high, higher than they should be on average over months, regardless of their diet, right? Now, if you get rid of diabetes. So with my clients, normally they can eliminate all insulin resistance within 4 weeks when I put them on things like my 6-week rapid recovery program, or they work with me directly. I put them on a high raw plant-based diet with lots of plant fats.
Oh, hang on, there we go. Plant-based bias. You can't go through an anti-keto video without hearing plant-based better, because that's what they're experts in. And so I don't doubt that you can have good results with this, but don't go saying the diet that I teach is bad unless you have evidence for it, doctor. So I'm not compelled by any new theory. This is an old theory that the saturated fat gums up the receptor or interferes with the receptors inside the cell. Now that theory is okay, and actually a low-carb keto diet fixes that intracellular fat, even though there's fat in the diet. I know it seems weird, but that's just what the science says. So no, I'm not going to change what I teach. If you like this video, please like it. Please subscribe to my channel. Send this to a friend. It's a grassroots effort after all. I hope that's helpful. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell. And check out adaptyourlifeacademy.com.